we are actually now talking about something really cool. We're talking about IV therapies. IV therapies is something we do a lot of. And I really enjoy doing these because there's a lot of great benefits to these that I absolutely think are beautiful. And for those of you guys who are considering IV therapies, I want to talk to you about first some of the advantages of them, what makes these kind of cool. And the second thing I'm going to talk about is some of the things you can actually use them for. If you have any questions, feel free to reach out. I'm going to be ready for you guys, but in the meantime, let's get started. First, let's talk about why we do IV therapies in the first place. As we probably can already guess, IV therapies bypass the GI tract, okay? Now this is important. Why? Because a lot of times we just are not absorbing through our gut. And this oftentimes happens if you have some intestinal diseases, by which IV therapies are a surefire way to get the medications or whatever into your system. Or let's say you've just been throwing up. Let's say you have some GI issues. Let's say you've come down with a stomach bug, or let's say you've been drinking too much, you've been throwing up, you can't keep anything down. A lot of times, some of you guys may be familiar, you end up in the emergency room to get some IV therapies. Bypassing the GI tract is one major benefit of even doing IV therapies. Pretty obvious. That leads to number 2, bioavailability. Now, bioavailability is basically a fancy term for medications reaching their peak levels or desired levels in a way that makes sense. For example, when you put topical creams on your skin, they don't oftentimes absorb because your skin is a fantastic barrier. It's supposed to be a barrier. Otherwise, everything you put on the skin would absorb. If you go inside the water, you become a pufferfish and blow up. No, you don't want to do that. So a lot of times, bioavailability is diminished because of the barrier. If it's skin, for obvious reasons, we talked about this, but also through the gut, because sometimes absorption doesn't happen. So putting medications directly into the IV tract makes them more bioavailable. This means that it is more reliable. Now, because the reliability is something you don't have to worry about the absorption, IV therapies make a lot of sense. So let's say you're depleted. Let's say you've lost a lot of vitamins and minerals. Let's say you feel terrible. A lot of the feeling terrible is because you are lacking potassium, magnesium, and essential nutrients that are lost if you've been throwing up or having significant diarrhea. A little bit of information for you guys, a little bit of trivia. Diarrhea is the #1 cause of death among children under 5 in the world. That's pretty terrible. Getting stuff into kids, you would think would be pretty simple. And now they've worked on all these different oral rehydration fluids, which are not as good as IV therapies, but of course getting IVs into the third world is very difficult. Somebody has to deliver them, somebody has to administer them. It's a pain. For those of us here in this country or in the Western civilization, we don't really have this problem, right? Now, in the third world, they're working on ways to mimic this with oral rehydration supplements. And I hope they get there, because God knows that's a lot of kids dying. Also, second trivia question. More soldiers died of diarrhea in the American Civil War than died in combat. This is true. So if they do those Civil War enactments, maybe they don't want to make them too realistic, if you catch what I'm saying. All right, number 3, or number 4, I should say, for obvious reasons, IV rehydration is faster. But as a general rule, pharmacokinetics, a lot of fancy words here, means you have to give 3 doses of medicine to get to the levels that are actually going to achieve anything. Whether it's antibiotics or whatever, you have to have at least 3 doses to get to the levels where it's actually working. That means if you have a major infection and you're doing oral antibiotics, 3 doses may be too late. So serious infections oftentimes mean you're going to go to the hospital and get IV therapies to get a loading dose. Fancy word, right? Now let's talk about some of the things that IV therapies can do in regular practice. Now I'm talking outside the hospital. I'm talking if you go to a medical spa setting like here at Avalon Laser in San Diego, all right? Number 1, you hydrate. Pretty straightforward. Now hydrating isn't just fluids, it also includes replenishing nutrients. So that means nutrients that are lost get replenished. So a lot of times if you're out there partying, getting sick, you've lost a lot of water, hydration is first, replenishing of nutrients is second. One of the things that we love to do with IV therapies is immune boosting. And especially nowadays with COVID, this has been a big hot topic, health and wellness, which is one of the reasons why we started doing this in the first place. I got peppered with so many questions from people on how to improve health. I basically made it my mission to try to disseminate health information as much as possible, and cut through a lot of the clutter and garbage that's basically flooding the internet nowadays. So, immune boosting is one of the key benefits of IV hydration because you can actually deliver agents that can boost your immune system. A little bit too much for the scope of this video, but I'll talk about it in other videos later on. This is where I get really excited, okay? Sports. Any of you athletes out there who want to get a little bit of a leg up on the competition, you know there are certain nutrients that you can actually use to both boost your performance before the workout, before the competition, and also speed up recovery. Muscles oftentimes go through so much during activities, and they can generate a lot of lactic acid, and they can injure themselves and cause that temporary muscle tear down. There are nutrients that you can actually supplement with that will help with recovery and get you back into training, and this is key for a lot of athletes out there. Any of you athletes out there, I know who you are, I used to be one of you, and go to it, because honestly, I miss those days so much. And if I had this back in the day, I can only imagine what my personal records would have been. Now, we get into the really cool stuff. Here it is. Ready for this? Anti-aging. Any of you guys who have been to me know that there is a key ingredient that we like to add, which is called NAD, nicotine adenine dinucleotide, big fancy word that biochemists like to chew on. NAD has been really being studied for its anti-aging properties. It is a key component in cellular metabolism, and that's the process by which energy is generated. As we get older, our cells begin to atrophy. We don't generate as much energy, which is why as you get older, you get tired, you get lethargic, you don't have the same energy that you used to have. So one of the things that's been studied is how to improve your cell function and decrease cell death and atrophy. NAD is one of those agents, pretty expensive, but it works really, really well at improving cellular function. I hope you guys enjoyed this video. There's going to be many more like it. I welcome your questions and comments. And if you're here in San Diego or in Carlsbad, come visit us at Avalon Laser. Thanks so much for watching.